What does a fecal calprotectin test mean for ulcerative colitis? Imagine trying to figure out if your stomach troubles come from a simple stomach upset or something more serious like ulcerative colitis. That's where the fecal calprotectin test comes into play. If you have symptoms like diarrhea, stomach pain, or cramping, your doctor might suggest this test to help find out what's really going on. The test looks for a protein called calprotectin in your stool. White blood cells releases calprotectin when there is inflammation in your intestines. If your levels are low, it usually means there's no significant inflammation. But if the levels are high, it suggests your colon might be inflamed, which is common in ulcerative colitis. Why does this matter? Because ulcerative colitis is a type of inflammatory bowel disease that causes long-term inflammation and ulcers in the colon. Symptoms can be similar to irritable bowel syndrome, which doesn't cause inflammation. So, the fecal calprotectin test helps your doctor tell the difference. When your doctor orders this test, they want to see if inflammation is present. If the results show high calprotectin levels, it points to active inflammation in your colon. This usually means you might have ulcerative colitis or another inflammatory condition. It also helps decide if further tests like a colonoscopy are needed to confirm the diagnosis. If the test shows normal or low levels, it's more likely your symptoms are caused by irritable bowel syndrome or another non-inflammatory issue. This can save you from unnecessary invasive procedures and help focus on diet, lifestyle, or medication changes to ease your symptoms. For people already diagnosed with ulcerative colitis, the fecal calprotectin test can be used to monitor how well your treatment is working. If inflammation is under control, the levels stay low. If they rise, it might mean a flare-up is starting, even before symptoms get worse. This early warning can help you and your doctor adjust your treatment plan quickly. It's important to remember that the test is most accurate for inflammation in the colon. Since ulcerative colitis affects the colon directly, the test is very useful for tracking this condition. However, if inflammation is mainly in the small intestine, as in some cases of Crohn's disease, the test might not be as reliable. In summary, the fecal calprotectin test is a simple, non-invasive way to check for intestinal inflammation. For those with symptoms that could be from ulcerative colitis or irritable bowel syndrome, it helps clarify what's causing the discomfort. A high result suggests inflammation and the possibility of ulcerative colitis, leading to further testing and treatment. A low result points to a non-inflammatory condition, allowing focus on symptom relief. This test is a helpful tool to guide your healthcare team in managing your digestive health effectively.